Are you Miss Cherry Pie Canopy, ma'am? Okay. Good morning, ma'am. I'm Angelica, your student nurse. Today I will assess your eyes, ears, nose, sinuses, and your mouth, ma'am. Okay? And perform hand hygiene. Wear glove if necessary. Provide privacy by closing the curtains and by closing the doors. Checking for sclerae. So her sclerae is white. No yellowish discoloration. Inspect cornea by directing pen light or obliquely from several positions. Okay, ma'am. I will shine your eyes, ma'am, with the lights. If it's okay, ma'am. Okay, so the normal findings, no irregularities on the surface, looks smooth, the cornea is clear or transparent, there is positive cornea reflex. So in iris, may I touch your face, ma'am? So her iris color is black. The anterior chamber is transparent. No noted any visible materials. So, in examination of the pupils, inspect including assessment of the size, shape, reaction to light, is observed for consensual response, for a constriction. Please stare to this object. It should be 5 inches from the client's nose. Okay, so the pupillary sizes ranges from 3 to 5 millimeters and are equal in size. Equally round, constrict sluggishly when light is directed to the eye, both directly and consensual. Pupils dilate when looking at the distant objects and constrict when looking at nearer objects. So, in visual acuity is tested using a Snellen chart. Make sure that the patient is standing 20 feet away from it. Can you please stand, ma'am? So, only one eye tested at the time. The other eye tested at the time. The other eye should be covered by an opaque card or eye cover, not with client's finger. So, ma'am, can you please use this to cover the one eye, ma'am? And see the Snellen chart, ma'am. Okay, in the other side, ma'am. Okay na, ma'am? Can you please sit down, ma'am? Make the client read the chart by pointing a letter randomly at each time. Each line may be started from largest to smallest or vice versa. In the assessment of peripheral vision or visual fields, requires the examiner and the client to sit or stand opposite with each other, with the eyes at the horizontal level with the distance of 1.5 to 2 feet apart. The examiner hold an object such as pencil or pen light in his hand and gradually moves it in from the periphery of both directions and above and now. Focus to this, ma'am. Inspecting the ears. Inspect the auricles of the ears for parallelism, size, position, appearance, and skin color. Palpate the auricles and the mastoid process for firmness of the cartilage of the auricles, tenderness when manipulating the auricles, and the mastoid process. Can I palpate your ears, ma'am? There's any tenderness, ma'am? Okay. And inspect the auditory meatus or the ear canal for color, presence of cerumen, discharges, and foreign bodies. For adult, pull the pinna upward and backward to strengthen the canal. So for children, pull the pinna downward and backward to strengthen the canal. Okay, ma'am, may I touch your ears, ma'am? Assessment of the nose. The following: inspect for the placement and symmetry presence of this corius. Can you please remove your face mask, ma'am? Okay. So it should be flaring of alanacy and patency of nares. In checking the patency of nares, you can do this by occluding nostril one at a time and noting for difficulty of breathing. Ma'am, can you do this, ma'am? Inhale, exhale. Another side, ma'am. Inhale, exhale. So no difficulties in breathing. So the external nares are palpated for displacement of the bone and cartilage, for tenderness and masses. While in checking the internal nares, you can do this by extending the neck of the client or the examiner's hand over the forehead of the client and using the thumb to push the tip of the nose upward while shining a light into the nares. Can you please remove the face mask? Okay. Did you feel any pain, ma'am? Okay. Inspect the position of the septum. Check septum for perforation can also be checked by directing the pen light on the side of the nose. Illumination at the other side suggests perforation. The nasal mucosa for swelling, exudate, and change in color. Can you please remove your face mask, ma'am? Okay. In paranasal sinuses, palpate the both cheeks. Simultaneously, one can determine tenderness of the maxillary sinuses, and pressing the thumb just below the eyebrows, we can determine tenderness of the frontal sinuses. Okay, ma'am, can I touch your face, ma'am? Did you feel any pain, ma'am? Okay. So the normal findings: nose in the midline, no discharges, no flaring alanacy, both nares are patent, no bone and cartilage deviation noted on palpation, no tenderness noted on palpation, nasal septum in the midline and not perforated, the nasal septum in the midline and not perforated, the nasal mucosa is pinkish, no tenderness noted on palpation of the paranasal sinuses. To test the adequacy of function of the olfactory nerve, Ask the client to close his eyes and occlude the examiner achromatic and easily distinguish notes. As the client to identify the odor. Each side is tested separately and ideally with 2 different substance. Okay. Can you please close your eyes, ma'am? Can you remove the... Close your eyes, ma'am. What's the odor, ma'am?
Alcohol.
Okay. Wait. On the other side, ma'am. What's the odor, ma'am?
Alcohol.
In mouth and oropharynx lips, inspect the symmetry and surface abnormalities, color, edema. Can you please move? Okay, so the normal findings with visible margin, symmetrical in appearance and movement, pinkish in color, no edema. In assessing temporomandibular, palpate while the mouth is open, wide, and then closed for crepitus, deviations, tenderness. Can you please remove your face mask, ma'am? Open your mouth, ma'am. Okay, ma'am. Normal findings, moves smoothly, no crepitus, no deviations noted, no pain or tenderness on palpation and jaw movement. Inspects the gums for color, bleeding, retraction of gums. Can you please remove your face mask, ma'am? Ma'am, say So, the normal findings, pinkish in color, no gum bleeding, no receding gums. Inspect teeth for number coloration, dental caries, dental fillings, alignment, and malocclusions. Tooth loss, breath should also be assessed during the process. Can you please, ma'am? So, the normal findings is 32 for adults and 28 for children. White, while 2 yellowish in color, without dental caries and dental fillings, without malocclusions, no halitosis. Palpate tongue for texture. Can you remove your face mask, ma'am? Can you stick out, ma'am? Okay, ma'am. The normal findings, pinkish with white taste buds on the surface, no lesions noted, no varicosities on ventral surface. Frenulum is thin, attaches to the posterior one-third of the ventral aspect of the tongue. Gag reflex is present, able to move the tongue freely with strength. Surface of the tongue is rough. Inspect uvula for position, color, cranial nerve 10, or vagus nerve, tested by asking the client to say note the uvula will move upward and forward. Can you please say ma'am? So the normal findings, position is in the midline, pinkish to red in color, no swelling or lesion noted, moves upward and backwards when asked, gloves and perform hand hygiene. Thank you, ma'am.